GRS Guide System, Dental Implant Surgical Solutions. Surgical Guide Fabrication Methods. A GRS surgical guide can be made using 3 separate methods: vacuum formed over a 3D printed model, vacuum formed over a stone model, 3D printed or milled. Creating a vacuum-formed GRS surgical guide over a 3D printed model utilizes the precision and accuracy of 3D implant planning software. Using 3D implant planning software, a virtual anatomic model is created with the desired angle, orientation, and depth of one or more implants. A clear 3D model of the patient's oral anatomy is printed. The printed model includes the implant channel at the pre-planned angle, orientation, and depth. A GRS locator pin is inserted into the hole that has been printed as part of the dental model. The locator pin shaft is modified so that the platform rests on the tissue for optimal surgical access or can be adjusted for any specific height requirement. The GRS surgical ring with the internal retention features positioned at the bottom is placed on top of the locator pin. The GRS protection cap completes the vacuum forming assembly. Insert a 1.5 mm to 3 mm plastic sheet into the vacuum pressure forming machine. Place the GRS vacuum forming assembly and model inside the forming machine. The plastic is heated and then lowered onto the assembly model. The newly formed plastic, GRS vacuum forming assembly, and model are removed from the forming machine. Utilizing a separating disc and laboratory handpiece, the surgical guide is roughly trimmed along the free gingival margins of the teeth. A channel is cut in the plastic to remove the excess material. The plastic covering the GRS protection cap is removed with a trimming burr, polishing wheel, or separating disc. The GRS surgical guide is removed from the model, followed by the locator pin and protection cap, which is removed with light pressure. The GRS surgical guide is trimmed to accommodate specific surgical requirements, polished, and placed back on the model to confirm fit and stability. A GRS drill sleeve is removed from the cassette using the GRS IR tool. The drill sleeve is then snapped into the surgical guide, and the IR tool simply separates from the drill sleeve using a sliding motion. The initial pilot drill with a GRS drill sleeve loosely attached is inserted through the drill sleeve to the full depth of the hole in the printed model. The GRS drill stop is secured to the drill with the drill stop driver. The drill is placed into the GRS depth gauge, which records the drill depth to an accuracy of 0.1 mm. All subsequent surgical drills can be set with drill stops at the same accurate position to ensure precise osteotomy depth. Creating a GRS surgical guide from a stone model is virtually the same, without the need for 3D implant planning software. A 2.3 mm drill is used to create a hole in the stone model representing the location and orientation of the implant. The 2.3 mm diameter corresponds to the shaft diameter of the GRS locator pin used when making a vacuum-formed GRS surgical guide. The GRS locator pin, surgical ring, and protection cap complete the vacuum forming assembly. A surgical guide created with implant planning software incorporates a cylinder diameter designed to receive the GRS surgical ring. The virtual surgical guide is then 3D printed or milled. A light, curable, medical-grade adhesive is placed around the inside of the surgical guide cylinder and outside the GRS surgical ring. A dental light cures the adhesive to create a strong bond between the GRS ring and surgical guide. The GRS surgical guide analog is simply removed using the IR tool. The surgical guide is now ready to receive all GRS drill sleeves. GRS Guide System, Dental Implant Surgical Solutions.